Great. Please start. Okay. Namaskar, Jai Gurudev, and a very warm good evening to all of the Vedyas, doctors that who have joined us on the live streaming platform of indianvedyas.com to listen into the webinar today that we have organized. Today, we have got two eminent Vedyas from India. One is from Bangalore and one is from Delhi. And the topic that we have chosen today is very, very apt in terms of the current pandemic that we are seeing. So without much delay, let me straight away share my screen and brief you about the Vedyas and today's topic. And if my screen is visible to all of you, the webinar today that we are talking about is the immunity, the role of the T cells, the cells of the thymus. And before we start the webinar, we would like to seek the blessings of our guiding light, Maharishi Mahesh Yogi Ji, who not only pioneered the cause of Ayurveda, championed the cause of Ayurveda in India, but at the international and the global levels. And it is with his efforts that today, Ayurveda is seeing a lot of interest. And we also pause and reflect to take time to express our gratitude to our founder and the guiding light, Anand Srivastava, whose interest in Ayurveda and whose undying passion for Ayurveda has stood the test of the times for Maharishi Ayurveda, and in the products of Maharishi Ayurveda, the legacy of his work lives on. And as a matter of fact, this information in the webinar is not intended to be implied as a substitute for a professional medical advice. If somebody is suffering for an ailment, please seek advice of a certified medical doctor. Well, today's session, we have got two eminent speakers, Dr. Vasudha M. Sharma. She is one of the leading Ayurveda doctors based out at Bangalore. Dr. Vasudha Sharma is a co-founder and medical director of Vivekananda Health Global, which is an international chain of integrative medicine based out of Bangalore, and which is a brand of Vasya Healthcare Private Limited, Bangalore. VHG, which is Vivekananda Health Global, is an outreach partner of Vyasa and has its research collaboration with Anvesna Research Laboratories, SY Vyasa, Bangalore. Dr. Vasudha is also an entrepreneur in the field of integrative medicine and Ayurveda and yoga therapy consultant. She is a researcher and an avid international speaker. She has also completed BMS from Bangalore and a PhD, a master's and a PhD in yoga from S. Vyasa University. And her doctoral work on Ayurveda and yoga therapy in the management of migraine and headache without aura was the topic. She has been a clinical practitioner for the last 2 decades, 20 years, and as a practitioner of integrative medicine since 15 years, combining the traditional Indian system of medicine, Ayurveda, yoga, and naturopathy. Her areas of specialization includes integrative pain management with a focus on migraine, headaches, and women health problems, including fertility. She has been a speaker at several international conferences, and the recent achievement was her unique presentation on the intervention of yoga and Ayurveda in the management of migraine headache at the American Headache Society's annual Congress in July 2019. So Dr. Vasudha brings with her an immense experience of being a researcher, a clinical practitioner, and kind of an avid international speaker. Welcome, Dr. Vasudha, for taking time to the webinar. Thank you so much. We have Dr. Saurav Sharma also with us, who definitely needs no introduction from Maharishi Ayurveda. He is a medical superintendent at Medical Ayurveda Hospital at Delhi. An avid Ayurveda practitioner for the last 2 decades, has been on the international and the national treatment kind of taking time for the patients and providing a holistic solutions. So without much delay, let me set the context here. And the context here is that the Journal of Nature, which is one of the prominent journals in the field of medical, right? And one of the very trusted and very credible journals, right? In the article on 11 Jan 2022, they published an article which says that killer immune cells still recognize the Omicron variant. And if I can summarize the gist, I think Dr. Vasudha will throw much light on this. The new variant remains highly susceptible to the T cell responses that includes Omicron. So we'll look as to how Ayurveda per se can help to enhance the T cells in the body and kind of provide a better perspective on immunity and how does proliferation of T cells in the body helps for a better immune system so that we can thought of not only viral, fungal, or any other infections in the body. So without much delay, let me welcome Dr. Vasudha for the presentation. And please go ahead with the presentation, Dr. Vasudha.
Yeah, thank you very much, and namaste everyone. So it's a good opportunity to be here on this platform and sharing my experience when it comes to today's topic. I think you have to just stop sharing, Anuji, so that I can share. So today's topic is a very interesting subject. And as Mr. Anuj has already set the context for all of us, this is the need of the hour, and it's the most happening requirement for all medical professionals, medical students, that the understanding of these aspects are very crucial for us to do well, serve the society well. So going on the same aspect, so what we need to understand is this whole world of immunology is very amazing. When you look at traditional description, obviously Ayurveda has explained this thousands of years ago. And when we look at the modern analogy and how the concept of immunology has really developed, the first Nobel Prize in the field of immunology was in 1901. And after that, until 2018, there have been 10 people who have received Nobel Prizes for work at different levels. There has been a multifactorial and a multi-systemic approach in this whole understanding. And what they've come to, is the point is the role of mind, lifestyle, and this has become the focus, or they become the foci in the last 15 years. And all of us know and we understand that there is probably no biggest defense force in the world unlike the human body, because it's so strong, but we are still exploring that. And when we talk about the immune system, therefore it's something which is very, very essential. And when we look at the body, there are different organ systems working at this level, starting from the adenoids to different other aspects, including the lymphatic system. So we are not getting into any of the details, but I'm just trying to get in the pointers. So when you talk about immunity, we first have to understand how they are classified, and this will also help us understand more about, of course, today's specific topic on T cells and immunity. So when we classify immunity, basically we talk about an innate immunity and an acquired immunity. So when you talk about an innate immunity, it means innate, that which you're born with. And when you talk about acquired immunity, it can be an active immunity or it is passive immunity. And active immunity is, also once again obtained by natural means, such as the development of antibodies in response to any infection, such as say chickenpox, for example. And artificial immunity is where the antibodies develop in response to, say, vaccination. So all of us are getting vaccinated now in this, to see that we try to keep away COVID. And when we talk about passive immunity, once again, it is natural, where you receive antibodies from, say, the child receives from the mother through the breastfeed. And artificially, once again, the antibodies can be released, where modern medicine uses such instances of injections using gamma globulins. So likewise, today we focus on specifically understanding acquired immunity, because that's where the T cells are going to be understood better. So as basically, we have understood that it involves and actively involves the lymphocytes, and that develops after exposure to any of the antigens. And when we look at the adaptive immunity, we talk about the involvement of B cell and we talk about the involvement of T cells. So you have an antibody mediated immunity, which is driven by the B lymphocytes, and they are like planning strategy, needed to destroy an invader. So when there's an external invader, that whole planning comes from these, and they are very, very crucial in fighting the extracellular parasites. So cell-mediated immunity is the other aspect, which is modulated by the T cells. And T cells are very, normally understood by a layman as soldiers who basically search and destroy the targeted invaders. And that's why they're considered to be so important, and they're effective against intracellular parasites and tumor cells as well. When we have to understand more about T cells, we just have to note the most crucial aspects. So they originate from the bone marrow, but they migrate to the thymus, and therefore they mature there and subsequently are exported to the peripheries. So here, when there are different types of T cells, the two prominent ones are the helper T cells and the cytotoxic T cells. So the word says it all. Helper T cells help the other cells of the immune system, whereas the cytotoxic T cells kill virally infected cells and tumors. So two other types of cells, probably, we don't place too much of prominence on them, but they're very, very important. The regulatory T cells, which stop an autoimmune response, once the threat is eliminated. And largely in traditional systems such as Ayurveda, this is what we work on. Our strong point is how do we really reverse an autoimmune disorder. Memory T cells. So just now, Mr. Anuj set the pretext. He spoke about, the journal Nature talking about killer immune cells, and that they recognize the Omicron variant. How did that come? It came from the stored memory. So this is present even after removing the pathogen, capable of responding to antigens. And therefore, it's so interesting, this whole field of immunology. And when we look at these facts, I just want to touch upon this interesting fact of naive T cells. So do you think that when T cells are matured, is each cell ready to fight? Does each cell is not ready to fight? And that's where they're called naive T cells. The naive T cells first must encounter an antigen, and then they're induced to proliferate and differentiate into cells which are capable to remove an antigen. That's where their fighting ability comes in. And how do they do this? Because they have this highly variable receptor, which is called the T cell receptor. As the image also shows, every T cell is also having a specific T cell receptor and antigen presenting cell. So the APCs express the major histopathology complex on their surface, and that is how they're able to really participate in this antigen antibody response. So as we're just talking about the same, I just have a very short quick look into this process so that the process says it all. So what this talks about is when an antigen invades, an interferon can influence the dendritic cell activation, and then we see the T cell activation, expression of surface molecules such as MHC and CD80, and the release of pro-inflammatory cytokines such as IL-12, IL-6. And when this IL-12 is produced by antigen-presenting cells, and this is how the activation and differentiation of the T helper cells happen. And this is very crucial, and this is the effective response, the cellular effector response, which is spoken about largely. So this is just a short glimpse to understand this whole process. And when we look at this role of T cells, especially in COVID, what do we find? There are, of course, many studies, but I just picked up one review article, which can give us this gist. And just interesting to note, this is a synthesis of 61 studies, which was published in PLOS in 2021. And what they have specifically identified is the T cells' role, in viral control and immunopathogenesis during the acute infection of COVID. And the role of T cells, once again, in establishing a protective immunity against reinfection, and also the relevance of the pre-existing pre-existing T cells in the cross-reactive, cellular immunity, and then, of course, in how they can really play a role in totally reducing the effect of the COVID or the coronavirus. So when we talk about the adaptive immunity response here, we just have to, concentrate on the CD8 or the CD4 cells, and the scarcity of this naive T cells is something which is specifically understood for the severity of disease in elderly. So we have seen during COVID also, right? And everybody was definitely cautious enough, or more cautious enough, because the elderly were affected more, especially we saw that trend even in the first wave and also in the second wave. So this is one of the reasons, why we saw that. And here, just to look at how modern medicine has also understood, we have spoken so much, and we've understood so much about immunology. And now today we are just throwing some glimpse on T cells. So here is one person, Dr. George Solomon, who has, who's from the University of California and who has worked exclusively in the field of immunology. He was also bestowed by the Nobel Peace Prize, and he acknowledged the concepts of immunity, especially when it comes to Ayurveda and the importance of stress, the behavioral response on the immune system. And obviously, when we talk about all the traditional systems such as Ayurveda and yoga, we talk about mind and body. So the Sharira and the Manas both are very important, because the kind of coordination which is essential is the best need for good health. So what I'm trying to say here is people have recognized the contribution from the sciences, but it's not that everybody has done it. There are probably few people who have done it, but definitely they know the scope of Ayurveda and systems such as yoga. So let's understand why there is so much of scope. What is the role of systems such as Ayurveda and yoga, which is the need of the hour? Because first point is the current health strategy. How is it focusing? It is focusing on the environmental factors, the pathogenic factors. But what do we need? Is that sufficient to probably treat ourselves? It is definitely not. So what we need is basically strengthening the host immunity to prevent spread of any infection, and also therefore downregulate the potential effect of the invading agent. So this is the need. And what are we doing with vaccination? We are inducing the specific immunity to the host, but that's not enough, because there are a lot of non-specific ways of improving the overall host immunity are needed, and that's therefore the need of the hour. And we are all here to understand more and contribute more to the society for upkeeping the health of individuals. So when we talk about immunity specifically with respect to Ayurveda, we understand the concept of Vyadhikshamatva. And what is mostly crucial in Vyadhikshamatva? It is the ojas. And how is Vyadhikshamatva or immunity more so understood? With the different classifications we have, like Sahajabala or natural immunity, Kalajabala and Yuktikrita Bala, which is the acquired immunity. So these are just an overall references which I would like to give. And when we talk about promotion of immunity, so Ayurveda definitely endless what all you can do to upkeep your immunity. So we obviously all the aspects of Dinacharya, Rutucharya, Panchakarma, and Rasayana are all there for the same purpose. And when you even talk about Rasayana in the form of Rasayana Dravya or the herbs, then there are so many of them, but I'm just bringing everyone's attention to 4 of them, which are Ashwagandha, which has played a very crucial role in especially COVID management, and Guduchi, Yashti Madhu, and Amalaki. So people have been talking about, okay, come on, take vitamin C, as soon as you're COVID positive. So this has been understood so well, so deeply in Ayurveda. And, we are all grateful that we are Ayurveda scholars, and we are, people who have had the probably the ability to learn the science. And when we talk about Amalaki, it's highly rich in vitamin C, very good immune modulator. And what is Chavanprash made up of? It's so rich in Amalaki and vitamin C. So that's what I tell patients many times, and help them understand the sciences better in their own way. So these mechanisms or these remedial measures are therefore very important, and these can play an important role in the proper functioning of the CD4 and the CD8 cells. So another paper, study which was published in the Journal of Environmental Science and Pollution Research in 2021 gave us some insights on Ayurveda remedies specifically. So how can Rasayana help? How do Ayurveda Rasayana herbs such as Guduchi, Eshtimadu, how do they really perform their functions? So they report that the immune enhancing effect and the response of CD4 and CD8 cells against viral infections is quite good, especially in these two herbs. And it comes to Amalaki, it's reported to enhance the immunity both in vitro and in vivo, especially in the natural killer cells and induced cytotoxic activity. So these are some references which specifically talk about the relationship between how Ayurveda works and how to interpret it with the modern understanding of immunity and specific reference to T cells. So one more interesting area is psychoneuroimmunology. So we are talking about immunology, and what is this psychoneuroimmunology all about? So this is basically something which is developed in recent times, and then it says it all: the interaction between the psychological process, the nervous system, and the immune system. So yoga also works quite well in this area. So your manas, the nervous system, when you talk about the vata imbalance or keeping the balance of the vata, and your immune system. So all these are very well connected, and they need to be at balance, and only then you can see and you can find that the health quotient is much better. When we talk about Loka Purusha Samyata, or when we talk about the the kind of balance or the dosha samyata in the body, these factors play a very crucial role. So let's also understand an analogy about yoga, because when Ayurveda and yoga are combined, I think we have very good beneficial effects and long-term effects. So when you look at yoga, the restoration of immunity is delivered through the integrative approach of yoga therapy, which is based on the concept of Panchakosha, the Annamaya, Pranamaya, Manomaya, Vijnanamaya, and Anandamaya Kosha. And in general, I've just put things together to say how can yoga help, especially in immune modulation. So genetically, it improves cellular immunity and also reduces the stress response. And how can this happen? Because it can improve the lifespan of a lymphocyte, it reduces the inflammatory response, prevents the metabolic deterioration, and improves your and decreases your autoimmune response. And all this happens because you have lowered cytokine activity, that is your inflammatory activity, and lowered cortisol. So this is how the homeostasis can be maintained well when you administer yoga. And please to understand that when we say yoga, we don't limit ourselves to only asanas, but yoga is an integration. It's an integration of loosening practices, breathing practices, pranayama, relaxation, meditation, and chanting. So all of them have to go into a session of yoga, and that's where I was speaking about the Panchakosha concept. So therefore, just to conclude, and I would like to say this: we have to protect the body, like the king protects his kingdom, and the charioteer takes care of his chariot. So Acharya Charaka has very nicely and elaborately put it: Nagari nagarasyeva rathasyeva rathiyatha swasharirasya medhavi krityeshva vahito bhavet. So beautiful, right? So it's so nice to also quote such shlokas. And what Acharya Bhava Mishra also says, Manavam yena vidhina swastastishtati sarvadha tameva karyat vaidyo yataha swasthyam sadepsitam. So when it comes to a Vaidya or a doctor, an Ayurveda physician, what is he or she supposed to do? You understand the concepts, instigate that practice by which an individual can live healthy, that is, your patient or your participant can live healthy, as health is the most desirable aspect of every human being. And this is such a important statement he has made, and we are glad that all of us are contributing to that very aspect of good health. And future is therefore in preserving the immune system, and everywhere. I think instead of an exchange of words between a bride and a bridegroom, or a would-be bride and a bridegroom, I think everybody would like to know how healthy you are, how immune you are, how good your immune system is to stay healthy and probably stay together forever. So with this just a short context, I close my presentation, and I once again thank Maharishi Ayurveda for this opportunity. Thank you once again. Namaste.
Many thanks, Dr. Vasudha, for the very interesting and making such a medical presentation so lively and so enriching. Even I was enjoying and understanding, and I'm very sure the young Ayurveda doctors that who listens to us, who has joined, right, they will certainly find it very, very useful. And I must say that you have covered the entire aspects of Ayurveda and the T cells and especially the build up in the scientific context. That is very, very important to understand that. Thank you so much, Doctor, for the wonderful presentation. And I will request all the viewers who are watching us to leave their comments and questions for Dr. Vasudha. We'll take time to answer that. In the meanwhile, let me bring in Dr. Saurav. Dr. Saurav, he is the medical superintendent at our hospital. And without much delay, I'll request Dr. Saurav to please share his experience in enhancing the T cells. How does Ayurveda you enhance the T cells? What are the interventions that you typically use in enhancing the immune cells and especially the T cells? Over to you, Dr. Saurav.
Thank you very much, Anuj. I hope I am audible. Perfect. Thank you very much. And Anuj really thanked very well Dr. Vasudha. I would also like to thank Dr. Vasudha very well, because it just took me back to the college days. When we were studying, it was really nice presentation, Dr. Vasudha, because it's very good actually, because this way of telling and teaching was very nice, because this is a very easy communicable way. People can connect to you, people can understand you and how the things goes on. Although Dr. Vasudha, you have covered everything. I really have a smile to say and nothing else. But let me just share some of my experiences and how do I do things in my clinical practice, especially in context to T cells, immunity, and basically, I would say, OJAS. So I hope everyone remembers the basics, right? And this pandemic, which is a kind of a blessing in disguise, has taught us a lot about how to live a happy, healthy life, following the laws of nature. And I'm really happy to say that, people's inclination towards Ayurveda has really increased a lot. And believe me, even in my clinical practice, I see more and more people coming to me for Swasthya Rakshana, which is very, very important, which I believe somehow, somewhere was missing. The Swasthya Rakshana part was missing. Like people would come certainly for treatments and everything, but this part was missing. And Dr. Vasudha said very good about these four magical herbs, what we speak about: Ashwagandha, Giloy, Muleti, Madhushti, and Amalki. So I will be sharing very clinical experiences only, okay, because I hope you guys would understand and you could correlate to what we actually do every day in our clinical practice. So people would come to you with exactly what Dr. Vasudha said about the taking Limsi and taking a lot of vitamin C. So the understanding of antioxidant part is very, very important. Very, very. So this is a very simple, line to say, yeah, I take a lot of antioxidants. Now, what are antioxidants? People, maybe they don't know yet, And, when it comes to understanding of immunity, when it comes to understanding of innate immunity and the other immunity, and the understanding of T lymphocytes and B lymphocytes, simply saying my WBCs are high or WBCs are low, was different, but now we understand how it goes actually. Let me take you a little back towards our Ayurveda concepts. Huh? So we always speak in my presentation. I think Dr. Juneja and Anuj and everyone knows me very well, and I've always been speaking about the Agni, Agni, Agni. So my whole practice goes with the Agni. Believe me. So for me, Agni is the most important thing, because in other ways also, if I would speak, in your clinical practice, apart from today's topic, if a patient comes to you and you are not assessing the Agni, mark my words, no matter everything goes well, no matter we have the bestest herbs, no matter we have the bestest combinations, compounds, rasayanas, you don't get exactly the result what wish you should get. So my personal suggestion and a recommendation is to always check a patient's Agni first. And now coming to the today's topic again. So here also, if the Agni is good, then only you are going to have good T cells. Now I'm correlating Agni with the T cells. Huh? How are we doing it? So the point is this, I hope you all remember. So where are these lymphocytes formed? Bone marrow. I'm going back. So Rasa Rakta, Masa, Meda, Asti, Majja, Shukra, right? So the Majja part. Now let's go back to the Agni. Where is your Agni? So if your Pachaka Agni, right, is balanced, then your Dhatva Agni and Panchmabhut Agni are balanced. So the point is this, we need to work on the Pachaka Agni. If you're working well on the Pachaka Agni, if your digestive fire is well enough so that your Aha Rasa gets converted into Rasa, then the Uttarattul Dhatus like Rakta, Mamsa, Meda, Asti, Majja, Sugar, then only you're going to have a good Majja Dhatu. Understanding? Simply. Right. So the immunity, we all understand that immunity, Ojas, is only found when you have good Agni levels. But the process is very, very important. So you find out the Agni of a patient. First, you do a little bit of Agni Deepan Chikitsa. Agni Deepana. So you have Deepana and Pachana herbs, right? So if you give Deepana and Pachana, you're not only increasing the Agni of the digestion, but you're also working on the Agni of the Dhatus also. I hope you all are connecting what I'm saying is this. So my suggestion is this. I mean, I'm going away from the subject as always, but my suggestion is this. When you are working with a patient, especially, I mean, in this current pandemic, so COVID and then, different variants, then this Omicron also came, everything is there. But as you must have seen, a lot of people became asymptomatic. So science says some became asymptomatic, some became symptomatic, some became positive, some became positive, then in 5 days they were negative. So everything is rolling around the Agni. Everything is rolling around the Agni. Everything is about the Agni. So if your Agni is balanced, believe me, your absorption is balanced. If your absorption is balanced, your dhatus are well formed. Your dhatus are well formed. And we should not, and again going to the Vyadhishamtu part, or let's say the Ojas part, or in our language, in our doctor's language, the T lymphocyte part also, that will only get properly manifested and formed if you have a good Agni. And let's go back to the simplest Sanskrit quotation we always speak, which is Samadosha Samagnischa Samadhatu Malakriya Prasannat Mainliya Manaswasteti Vidyate, which is very simple. To say it is very, very simple, guys. But to understand it is very, very important. And this all can be achieved by, so in this perfect health quotation, you have Prasannat Mainliya Mana also, right? So in this particular scenario, what I believe is this, formation of good quality T lymphocyte cells also depends on the Prasannat Mainliya Manaswasteti Vidyate part also. That's why, there a lot of counseling has been done in this current pandemic, that people are speaking, okay, stay with your families, stay relaxed, everything will be okay, sab theek ho jayega, everything, things will get better soon. But this is not placebo practically. We all doctors understand. This is not placebo, because it regulates your pituitary. From pituitary, the hormones like ACTH and other GH hormones are regulated. So if they are regulated well, then the formation of other, the Dhatu Agni part is also better. So I'm just trying to correlate. See, please try to understand. This is just a correlation. Now I'm correlating stress factor to the immunity, which is understandable that, if the stress factor is deviated or disturbed, then the pituitary gland functioning is less or hypo. And then the other formation of the immunity also gets bad. I'm sorry to use it. And then you're susceptible towards any kind of further infections or allergies. These days people are coming to me, believe me, it's a very interesting story. People would come to me every day. let's say 30, 40 patients, and in the evening or a couple of days back, they'll just give me a call, oh, Dr. Saurabh, I got a little flu and I think it is COVID. And lately, when they go for the test, they turn out to be positive, but asymptomatic. So my point is this, the asymptomatic word came obviously from the science, but from your OJS also. So those people who have very good OJS, very good lymphocytes, have very strong immunity, they got really asymptomatic. And somehow this is very, very important. So Dr. Vasudha spoke about Ashwagandha, Giloy, Madhushti, and Amalki. So Amalki, we all understand the vitamin C ascorbic acid part, right? Ashwagandha, we also understand the Balya, the Vajikarak, the Vigar, the immunity, the Nava tonic. Muleti also. Muleti, I tell you one thing, very simple, guys. So Madhuyasti, although it's a very simple herb, but what in my clinical practice, I use Madhuyasti as one herb for everything. One herb for everything. Believe me, any kind of inflammation is there, you can give Muleti. URTI, you can give Muleti. Gastritis, you can give Muleti. Skin issues, you can give Muleti. Dermatitis, you can give Muleti. Stress factors, you can give Muleti. So I'm just trying to tell you very simple thing, because these simple 4 herbs, which Dr. Vasudha just said, I really, when we were in college, we were always speaking about single herbs, and they work very well. The point is this, the proper combinations and Anupana is very important. So if you have all those 4 things, believe me, half of the practice is done. So the point is this, coming back to the OJS part, and I hope everyone remembers that Sanskrit quotation also. Atma mansa sanyujate man indriyam arthen tato jnanam. So this is how you get the perception of any sense, right? So your mind, body, and senses, mind, body, and senses, they are to be into the harmonious state, or let's say the balanced state. And that comes when there is no stress. I'm not going away from the topic, don't worry. So not stress means outside stress or physical stress or mental stress, means all kind of stresses. And that can be balanced by following a good diet and daily routine, which is very simple to say, but very hard to follow. Close your eyes and ask yourself, but that's very hard to follow. But we can do that because we are Ayurveda scholars, and we are here, as Maharishi said, about creating a, I'm speaking very fast, I know, but let's catch it. As Maharishi always said about creating a disease-free society, and that can be achieved with this. So let's come back to the current topic. Now, this immunity, or let's say a good OJS, a good optimum quality of OJS can only be achieved by a good Agni, balanced doshas, balanced dhatus, so that the each and every dhatu is found particularly, and also the balance in, let's say, absorption of the body, absorption, which is very important. In my clinical practice, I just spoke about these 4 simple herbs. But Anuj, here I would like to add something. I hope most of the people are pretty familiar about a very highly effective, not product, I would say a blessing from God, which is Amrit Kalash, Maharishi Ayurveda Amrit Kalash. I hope everyone knows about it. But do we all know how it works? It works the same as all other rasayanas do. The way Amalaki does, the way Madhushti does, the way Ashwagandha does, or the way any kind of herb or spice does. But the best part. Now I'm just picking few points, then I will be finishing. So the best parts. First, Amrit Kalash is a combination of 53 herbs, which we all know, nothing new. But the permutation and combination, which we understand, have been kept very nicely in the mind, and the preparation process is very, very strict and in good quality. And the best part is this, those hands which are preparing the Amrit Kalash, this is now very important. I always speak about it because I really love it. And the hands, it means the people who are manufacturing or preparing the Amrit Kalash, which is a broadest spectrum antioxidant, so far I know, okay, are meditators. So now I'm correlating the stress part, fine. So the blissful hands preparation, I'm not doing any marketing, I'm just telling you a very good personal experience because I know how it works. And believe me, guys, I have been giving Amrit Kalash to all my patients who are undergoing any therapies, who have already suffered from COVID, who are suffering from COVID, and who are clever and intelligent enough to understand the the importance of immunity, and are willing to understand the concept of Swasthya Rakshana. So the very important, in the beginning, I started with the Agni, right? So now I come back to the Agni. So with Amrit Kalash, which comes in the form of a combination of 2 packs, one is a paste and another one is the tablet. It is very, very strictly kept in mind that the Agni has to be important. So if you see the composition of Amrit Kalash, the MAK4 paste has got all the Agni, Deepan and Pachana Dravyas, which basically balance your Agnis. It means, so there are 2 things. So they are Agni Deepan. So they are balancing your Agnis. It means they are improving the digestion power. So it means the normal food, now understand my point, even if the normal food, whatever you are eating, it is going to enhance the digestion and absorption of that also. So the immunity, or let's say the good quality of ojas you will get from your food will also increase. It's very simple. And the other preparation, which is MAK5, has got all the herbs which, now I'm coming back to immunity. All the herbs which are basically balya and pushtikara. It means it gives strength to the body, immunity improving, anti-aging, all the like Ashwagandha, Vidari and all those things. So now the point is this: working on the immunity, improving the absorption, working on the let's say immunity, increasing herbs from the body. Now the point is from the body, not the, okay, normally what happens is this: we take certain food supplements like medicines or capsules. Okay, take this for vitamin E, vitamin D, vitamin C. But the best part is this: if you have a good Agni, you are able to absorb it from the food. So coming back to the T lymphocyte part, friends, the point is this scenario is present. We never know, there can be another scenarios. Let's work together on improving the digestion capacity, improving the immunity, taking good quality of rasayanas, having meals on time, and definitely, as Dr. Vasudha said about Ayurveda, connecting back to the nature. This will improve everything. This is going to strengthen everything. And I believe Ayurveda scholars are majorly the pillars to really make this society disease-free. So with this, I will not take a lot of time. There are thousands of clinical experiences which I wanted to share, but I know we are running short of time. Dr. Vasudha said everything very well. So thank you very much for patiently listening. And if there are any questions, we are really, really happy to answer them.
Many thanks, Dr. Saurav, for the wonderful presentation. I'll quickly go over to the question due to paucity of time. There's one question, Dr. Vasudha, which comes on YouTube from a young doctor saying that in your daily practice, which are the rasayanas that you typically use for the proliferation of the T cells or for the immunity? So building onto that context, I know Amrit Kalash is one research product which builds onto the T cells, and they have been in clinical study, right? So, Dr. Would you like to take that question and answer to the doctors who are listening?
Yeah, sure. So I think it should be the most pertinent question for today's requirement. I agree with Dr. Saurav, when he says Yashti Madhu. So that's also one of the favorite herb I use. Like he said, he uses, I think, at all categories he mentioned, I also use, and I watch for Madhu Yashti or Glycyrrhiza because it does wonders. And when you use it as Kshirapaka, I would suggest Yashti Madhu Kshirapaka made in the Kshirapak Vidhi. Is one of a very good, immune modulators which can enhance and T cell functions, reduce inflammation. And in clinical practice, otherwise Chyawanprash is one other combination which is, of course, marketed by many pharmacies. But traditionally, we know it has a mention in Charaka Samhita. So that is another, great, aspect of Ayurveda which we have obtained. And Chyawanprash is otherwise, known nowadays from XYZ companies, but then I think we have to be very particular that we use Chyawanprash from known pharmacies, known for their quality. So that is something I want to very specifically stress. Otherwise, it's a great elixir, and don't think you should take Chyawanprash only if you want to feel I want to increase my vitality or ojas. But you can take Chyawanprash, which works excellently well for an upper respiratory tract, a normal kasa, shwasa we talk about in general. And of course, I've also used Amrit Kalash, and I have definitely got good results when it comes to, immune compromised cases, such as patients with cancer, for an example.
Thank you so much, Dr. Vasudha. And just to add to your point, you very nicely mentioned the Chyawanprash. There are 110 preparations, so even I was not aware. And this was kind of a famous thing that our chairman used to say to us, that when Maharishi ji prepared the first Chyawanprash batch, So he asked, which Vansh Lochan have you used in the Chyawanprash? So somebody said, we have used this quality. So Maharishi was very angry and he said, you dumped the entire batch that you have prepared. We are not going to sell the Chyawanprash, which is, made by spurious or substandard Vansh Lochan. So that is the reason why, we take utmost care in preparing the Vansh Lochan. And this is one thing I very clearly remember from the doctors like you and others, that Vansh Lochan is very, very important. Thank you so much, Dr. Vasudha. Dr. Saurav, one last question to you. There are a few minutes remaining. Is that how does transcendental meditation or any meditation would you recommend, along with, because building on to what Dr. Vasudha said, yoga, medication, so Ayurveda doesn't approach any treatment for that matter in a single window, so it's a holistic approach that we look at from a medication standpoint, from a lifestyle modification, from food, from other modifications. So how does, one keep healthy with the medications that we have, and then the forms of medication, especially transcendental meditation? You're on mute, Dr. Saurav. You're on mute. You're on mute, Dr. Saurav.
Thank you. Thank you. It is a very practical question. And in this, as I said, in this current particular scenario, we understand. And in the beginning also, I said, Samdosha Samagnisha Ratu Malagri Prasannat Mendya Swastheti Vridyate. So this definition of swasth, or let's say good health, or let's say perfect health, itself says the swasth man and indriya and atma. And that will come with proper meditation. And believe me, in my clinical practice also, and this is scientifically proved also, as I'm saying that about the pituitary gland and hypothalamus. So pituitary gland is governing everything in the body, the secretion of all the hormones, ductless and ductful hormones, and all kind of motor functions in our body. So as I said, and I always ask my patient, medication is important, but meditation is equally important. And when we speak about the transcendental meditation, okay, I'm not the meditation teacher, but I can say there are hundreds and thousands of researches done so far, which are basically, proven for improving immunity, improving good sleep, improving cardiac health. And I'm really fortunate to say that thousands of people have got rid of medication just by following meditation. And in Ayurveda, we always speak about mind, body, and soul coordination. So it's always the same, So mind has to be balanced, body has to be balanced, and equally the soul has to be balanced. So the whole blissfulness comes together actually. So I think this is most important.
Thank you, Dr. Saurav, for the answer. Dr. Vasudha, there's other questions coming in that in today's context, if you look at, many of the consumers, or even people like me, traveling and a busy lifestyle, are there any specific yoga, yoga poses that you recommend, quick, like 5 minutes, 10 minutes, or, because we understand the paucity of time. Everybody says we don't have time, right? So many of the Vedyas and the consumers are asking that apart from Amrit Kalash, do you recommend any other, yoga or particular pranayam or whatever, so that the patient feels much better?
Right. So it's a very, very well understood, and especially say with clinical practice of using Ayurveda and yoga, the combination has definitely worked wonders. So be it say in the management of COVID to speed up recovery, when we introduce say practices such as pranayama or breathing exercises, when there is intensity of cough, especially, people find a lot of relief. Of course, medication is essential. But if we find an improvement of say 5 from a range of 1 to 10, we'll definitely find improvement up to 7 with the combination. Likewise, when you're on travel and when your diet lifestyle is not very regulated, it's important that you spend at least 20 minutes every day in doing certain practices, along with maybe taking some immune modulators or rasayanas such as Chyawanprash. We just discussed about that. So the most crucial practices would be probably loosening up, certain loosening exercises based on your sensitive points. Most of us might have a neck and shoulder sensitivity. We are sitting on the chair or we use a desk all the time. So simple movements of the neck, shoulders, etc. But do it with breathing. So that is the most crucial aspect. So what people do is just move your head up and down. This is not going to help you. So you have to do it with breathing, because breathing can bring that the kind of connection between your mind and body, and that can help you relate. because breathing can balance your prana or the vital energy, and therefore the technique of pranayama is also recommended. So there's a difference between what I just spoke, which are breathing techniques, and pranayama, which are regulated breathing techniques. So there are some quick modules also which we give out at VAG. So people can also learn as and when they want to.
Great answer. And I must acknowledge that I was in Bangalore a few months back and had the pleasure of visiting Dr. Vasudha's center. And I must say that one of the very nicely designed, aesthetically appealing, it doesn't look like a clinic. It's basically a very nice setup that Dr. Vasudha has. And I must say it's very nice. And I will request, if anybody goes to Bangalore, please pay a visit to Dr. Vasudha. The mere appeal of that is 30-40% of your disease will go away, because the setup is so nice. It's so calming and so nice. So with that, Dr. Vasudha and Dr. Saurav, we are running very short of time. I'm so sorry that we could not extend. It's been long. I had a presentation, but then keeping in mind the time and the guidelines, right? I will say thank you very much, Dr. Vasudha, for taking out your time from your busy schedule and kind of helping the young Ayurveda doctors to understand more nicely and in-depthly about the role of the T cells and how does various interventions, be it the medication, the yoga, and the others, plays a very, very critical part. Thanks to you, Dr. Saurav, also for bringing in the holistic approach, and also pointing out that it's not only the rasayanas and the medications, but also the cognitive part, the meditation, that also plays a critical role. And many thanks to Indian Vedyas, especially to Dr. Piyush, for giving us this platform. And to all the Vedyas, all the doctors who have been supporting Maharishi Ayurveda, who have been using our product, we can assure you one thing at any point of time, is that we do not have any problems with the quality as far as the product is concerned. It's non-negotiable. And please keep writing to us, following us, and helping us in the quest of Maharishi Mahesh Yogi Ji to create a disease-free society. With those words, wishing you all health, happiness, and keep propagating the value of Ayurveda. Jai Gurudev. Thank you so much. Thank you so much.
Thank you.
Thank you.